the issues are in each laboratory. And I just want to thank Administrator Verma, who really worked on increasing the funding for this test and uniquely doubling the funding for the coronavirus nucleic acid test. From $50 to $100 to really address some of the issues about laboratory technicians, because sometimes we think these tests run themselves. They don't. They actually need people to help with the machines. So we were talking about purchasing more machines. We actually need to have additional laboratory technicians to really be able to work all of those machines. And so it's lab by lab, state by state, and that's the dialogue that's going on now to unlock the full potential of the United States. Maybe the testing would not be needed at this moment, and maybe it is, but we want it also totally available in the fall if it comes to an issue where we have to distinguish between flu and COVID-19. So we're building infrastructure and capacity not only for today, but for tomorrow, and really showing a new way to really deal with pandemics and bring testing to scale, because the country has never had to do this before. I mean, if you look at some of the other countries, they're struggling with some of the issues from PPE to testing. And so this is a universal issue, but we're working on it as a collective to really have a very innovative and integrated way to approach testing.
But without building new, they have tremendous capability.
And the maps are, I will ask the companies, because obviously it's proprietary where every single machine is. And, you know, if you have that machine and 5 others, maybe you don't want to know, let that person know you have 5 others. It's kind of like Coke and Pepsi. So I think we're working very deliberately to really be able to share those maps. The governors, I can tell you that all of the state governors and the mayors have those maps, and the addresses and the type of machine for every single laboratory in their jurisdictions, so that they know.
The governors were not aware that those laboratories were available to them.
Dr. Burns, before you leave, on the state of California is now partially broken with CDC restrictions on who would get guidance on who should get testing, because they want to test people without any symptoms at all in high-risk environments like a nursing home. Do you agree with this? Vice President Pence, do you agree with this?
Well, not only do we agree with it, it was in our guidelines. That was fundamental to our guidelines, and I think we were the first group that said testing asymptomatics will be key. We've always said that we think that's a significant contribution to infections, and we went to the places where we thought it was most critical to find cases the earliest, and so that is where we have asked states in the guidelines to start with nursing home, indigenous peoples, and people in underserved areas in cities to really ensure that we're monitoring for any type, because we know the asymptomatic piece may be the tip of the iceberg, in fact, be the iceberg underneath the surface. And so if you're only seeing cases, maybe this. But in parallel, we're working with states and local governments to really define what that population is by doing, in collaboration with states, working with them together to really reinforce this antibody testing, but in a careful way where you do 2 antibody testing to increase your sensitivity and specificity into the 99+% range, because we think it's really important that you have a very high-quality test, but a high-quality test that you can really tell someone that they've had this before. And so we're waiting to have those 2 tests that we can do in series to really assure people. But that was in the guidelines from the very beginning, and we think it's fundamental both for right now and going through the fall, because that will be our early alert if any of the COVID virus reappears.
How much more testing are we going to need?
You didn't know that was in the guidelines?
The CDC.
Well, it's currently in the CDC guidelines. So you're saying
It's right in the guidelines.
Dr. Burns, while you're there, can I just...
Jerome, would you like to say something in that, please?
Thank you, Mr. President. And I just want to reiterate to everyone that the task force and the administration have a commitment to protecting vulnerable people. And that includes in the area of testing. We've had the opportunity to talk to many different groups, and we hear that testing is absolutely a concern. And we'll be giving you more details in the coming days, but I just want you to know that we're building on the public-private partnership that the President rolled out with pharmacy and retail companies like CVS, Walgreens, Rite Aid, Walmart, and Kroger to accelerate testing for more Americans in more communities across the nation. We're going to be increasing access to testing for undertested, underserved, and minority communities. And we're working closely with partners and states to establish sites in areas most in need of increased access to testing. We're using data. CDC provided data to locate sites in counties that are undertested and socially vulnerable, especially with high populations of Black, Hispanic, rural, and Native Americans. We're using the CDC's vulnerability index, as you heard about earlier, to select sites. This measures the resilience of communities when confronted by external stressors along 4 main themes: socioeconomic status, household composition, and disability, minority status, and housing type. Our goal is to have about 2/3 of these initial sites located in counties with moderate to high social vulnerability, and about 1/4 of these sites in counties with high social vulnerability. So again, I want communities that are vulnerable to understand that we are strategically and intentionally making sure we're deploying testing in those areas so that people can get identified if they have symptoms, can get identified if they are asymptomatic, and that we will be able to deploy resources appropriately.
Thank you, Mr. President.
I have a quick follow-up for Dr.
And I have to
Bird.
say, our Surgeon General is doing a great job. Thank you. Great job.